The Texas Health Information Exchange Coalition, or THIEC, is a collaborative effort of all the initiatives in the state of Texas to put together a common voice regarding health information exchange issues. We created the concept about 3 years ago when each one of our initiatives around the state really were struggling to put a face to that whole idea about health information exchange. We very quickly realized that we all basically fight the same enemies, we have the same issues, so we said there is a lot greater power in working together rather than just trying to figure it out all ourselves. So that became kind of the genesis of this exchange coalition. The issue of cost, workflow impact, and actually overall value is going to be on the top of every physician's mind. Physicians in the current environment are really forced to be very efficient in what they're doing right now, and any kind of disruption kind of takes away from that level of efficiency. In the long term, we have not encountered one physician that says this idea about an electronic medical record is crazy, let alone the ability to exchange data between me, my colleague, my cardiologist that I use and what have you is not effective. So I see a tremendous amount of willingness and interest amongst the providers, but the issue is really how do you put it in front of them at a reasonable fee, and also how do you put it in front of them with a minimal level of disruption. I think where the coalition really helps out is to develop almost best practices amongst all these information exchanges that we could then all start using to really hit our own markets. So, for instance, what we're doing, one of the subcommittees of the coalition is a provider outreach committee where we share experiences on really what we encounter when we go out and talk to physicians, talk to hospitals. We create a best practice approach, and the beauty of it has been that there's a lot of collaboration going on. So it's more like an indirect really benefit rather than directly reaching out to doctors.